The DG variant is identified by the newborn screening program and is expected to occur in about 1 in every 500 newborns. Newborns with this variant are not at risk to have the disease galactosemia. The following illustrations explain what the DG variant is. This is how galactose is broken down. It is first changed to galactose 1-phosphate in preparation for the action by the GALT enzyme that breaks down galactose by converting it to glucose 1-phosphate, an important body fuel. Other enzymes, indicated by the dashed arrow, assist in this reaction. An indirect measure of GALT activity is the fluorescence test used for newborn screening. When there is full fluorescence, the enzyme activity of GALT is normal. When GALT activity is reduced, it is reported as a partial or borderline result. Severe reduction in GALT activity is reported as 0, with values equal to or less than 2.1 units, and this is often associated with true galactosemia. Unit values for this test can vary depending upon test methodology. This illustrates different GALT enzyme activities, noted by the bars, and the possible genetic conditions, called genotypes, associated with these different levels. 100% activity occurs in what is termed the NN genotype, which stands for 2 normal GALT genes. Every person has 2 GALT genes, one inherited from each parent. The designation NN means that both of these genes are normal. Alternately, GG indicates that both genes have a severe abnormality that will lead to essentially no enzyme activity. Between these extremes, note the genotypes that can reduce but not eliminate GALT enzyme activity. Newborns with these genotypes do not have galactosemia because they have enough enzyme activity to prevent the disorder. We now know that a relatively common mutation, called the Duarte mutation, designated as D, can be detected in up to 5% of individuals. This Duarte variant does not completely disrupt the activity of the GALT enzyme, but does diminish it. Individuals who inherit one of the Duarte mutations have a total enzymatic activity of 75%. Inheriting 2 Duarte mutations, one from each parent, leads to 50% total activity. Essentially, the same enzymatic activity can be caused when a baby inherits a normal gene, N, and a severe galactosemia gene, G. Importantly, if a baby inherits a D mutation from one parent and a G mutation from the other, that condition is called the DG genotype, or DG variant. These babies can have relatively low enzymatic activity, usually in the 5 to 25% range. A partial fluorescence test will detect individuals who are in this mid-zone range, but to determine what mutations are causing the partial fluorescence, molecular testing must be performed to determine the genetic constitution, or genotype, of the baby. Management of babies with the DG condition is somewhat controversial, although most follow-up centers perform some type of monitoring and oversight. Breastfeeding can be allowed, but sometimes non-galactose-containing supplement formulas are used. The use of supplemental formulas is sometimes based on measuring of the baby's blood level of galactose 1-phosphate. The University of Florida Division of Genetics has a protocol that can assist practitioners in managing babies with the DG variant. This protocol is located on our website.